a healthy diet, more specifically the Mediterranean diet, can decrease the risk of developing depression in 30%. We know that there is the bidirectional connection between obesity and psychiatric disorders in general. And probably inflammation is one mechanism that underline this connection.
People with severe mental illness, schizophrenia, depression, bipolar, tend to have higher rates of cardiovascular disease, obesity, type 2 diabetes, tend to die earlier, 10 to 25 years, that mortality gap, depending on the data set that you look at. So there's direct effects of the diets, like you're talking about, a Mediterranean diet on the depressive symptoms, but also potentially huge effects on physical health and underlying comorbidities.
It's very challenging in the field of nutrition perform a clinical trial due to the nature of a nutritional intervention, right? It's super hard to keep people in the same experimental diet for a very long term.
Before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment. Hello everybody and welcome back to the show. Today is a special episode as it is our first deep dive into nutrition and mental health. We've been very lucky to have some wonderful guests on the podcast in areas of mind-body practices like yoga, sleep, and exercise. And today we traverse into a different lifestyle behavior, nutrition. We're lucky to be joined by Dr. Lais Bhering, who is a dietitian and researcher in the field of nutritional psychiatry. She's a scientific collaborator at the Geneva School of Health Science, and her research has taken her across many continents, from Brazil and South America, where she's originally from, to North America, to Europe and Switzerland, where she's now researching. In today's episode, we discuss the evidence behind the Mediterranean diet, vegetarian diet, and the ketogenic diet for mental health, how food impacts inflammation and the birth of new neurons in the brain, tips on critically analyzing social media commentary and research in nutritional psychiatry, the impact our food systems have on the environment, and much, much more. If today's episode of the show brings you value, we would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here is to continue to deep dive into lifestyle behaviors which are accessible and applicable for people the world over, and to provide an evidence-based resource for people to take action and improve their own mental health and well-being. And you sharing, liking, and/or following and subscribing helps us to spread the word. Thanks so much for tuning in, and now to today's deep dive with Dr. Lais Bhering on all things nutritional psychiatry. Dr. Lais Bhering, welcome to the Mental Wellbeing College.
Thank you for having me, Indy.
Yeah, it is absolutely fantastic to have you on. This podcast, we've traversed a lot of different lifestyle behaviors, from exercise to sleep to mind-body practices, but never nutrition. So you're the first in the field of nutrition psychology to grace this podcast.
No, I'm glad about that.
Yeah, and me too. And obviously nutritional psychiatry is a field that is new, but there's a lot of information out there still on places like social media, on the internet. So to be able to traverse the evidence space with you, with an expert and a researcher in the field is a really cool opportunity. But before, Lais, we do dive into some of the evidence, it'd be good to hear a little bit more about your journey into nutritional psychiatry, your personal journey. How did you get into this field?
Yeah, of course. I'd love to share that because, well, I'm very proud of being a nutritional psychiatry scientist. I'm actually very enthusiastic researcher in the field of nutrition, and it has been like that since my bachelor's, when I did my bachelor in nutrition. But my interest in the field, or in the connection between nutrition and brain functioning, it started during my master's degree. in food science when I tried to test nutritional interventions to treat migraines. And during this time, during my master's and my PhD, I had the chance to work with excellent researchers in the field of psychiatry and neurology, and we had the chance to test the effect of using ginger to treat migraine, and we had a very positive impact in decreasing in relief pain. And since then, I mean, like I got very passionate about the field of nutrition and brain functioning. And then after that, I joined my PI during my PhD and my master's. I joined him in the Department of Psychiatry and Behavioral Science in the University of Texas Health Science Center at Houston to do my postdoc in psychiatry. So, well, that is more or less my journey in the field, and I am very excited to share with you what I know about it, what I have been studying, and because I believe that's a very exciting field, and we can get a lot of advantages from adhering to a good diet, a health diet, and we can have advantages for our mental health and metabolic health in general.
Yeah, it's a really cool journey to hear about, and I know it's taken you across the world amongst different continents as well, from America to Europe.
Yeah.
So I'm certainly excited to dive into some of your research that you've done as well. And you mentioned there that you can have a lot of benefit, and I think obviously diet and nutrition is something that we all do, we all eat. So certainly, on to something there in terms of nutrition being very accessible. And on that note then, Lais, I'm curious, what is, or rather, why is nutritional psychiatry important in the context of the current mental health crisis? What kind of benefits can it serve us as humans?
Yeah, very good question, Indy. Well, the nutritional psychiatry, maybe to set up the scene a little bit, nutritional psychiatry is the field in which we study nutritional factors, not only diet itself, but everything related to diet. So, or everything that diet can impact. For example, body composition, microbiota, nutritional supplements. So we study the relationship between these nutritional factors and psychiatric disorders. And this is a relatively new field in science because the first clinical studies that we have in the nutritional psychiatry, observational studies, started popping up in the literature around 2010. And from these studies, we had very exciting data. For example, we know that a healthy diet, more specifically the Mediterranean diet, can decrease the risk of developing depression in 30%. So then, since then, we have been studying the effect of diet in mental health. But as you know, like the observational studies, which are the studies that the researchers do not do any type of intervention. They only observe people for a certain period of time, and they try to make associations between the person's people life habits and the risk of developing something. So from these studies, we have information about association. As I said, we can say that the diet can decrease the risk of depression. However, we do not have any information about cause or effect of diet. For that, we need to have clinical trials. We need to have interventional studies. And the first well-designed clinical trial in the field of nutritional psychiatry was published by Felice Yaka. She is a very important name in the field of nutritional psychiatry, and I am a big fan of her. And for those who want to go deeper in the field, I highly recommend reading her publications. So in this trial, I'm going to talk a little bit about the trial because it was super interesting. The trial called Smiles, which is a very nice name as well. And they tested the effect of a nutritional program. They had a sample of patients with depression, and they split the sample into those who received a nutritional program that it was basically advice about the diet, and the advice was based on Mediterranean diet as well, with a slightly modification, because they allowed the participants to eat a slightly higher amount of red meat and dairy, for example. And then they compared this group with another group that received social support. And they found out that those who received the nutritional intervention, they had a better result in decreasing depressive symptoms, and they also had a higher frequency of remission. So this was a very good data and exciting data for the field. And after this clinical trial, there was another clinical trial developed developed by another research group in Australia as well, because Feliciaca, she's also from Deakin University. She's the director. There is one very nice center in the Deakin University called Food and Mood Center, in which Feliciaca is the director of the center. So it's also a good tip for those who want to engage, like to know a little bit more about the nutritional psychiatry field. It is a good center to follow and the research of the center. But in this other clinical trial, they tested the nutritional intervention also based in Mediterranean diet, and they combined with supplementation of fish oil, omega-3, which it is the nutritional supplement that we have the greatest amount of evidences showing benefits. And they also compared the group that received this intervention with social support, and they also had a better result in the group that received the nutritional intervention in decreasing depressive symptoms. So it was also another proof that we can use the nutritional intervention also to treat. We can decrease the risk of developing depression, but we can also treat patients with depression with this intervention, and this is very exciting, in my opinion. Yeah, and just to go to the second part of your question, or the first part that you asked me, what I think is the importance of the field for psychiatry, right? Well, in my understanding, it is very important because we still have a large amount of patients that do not respond to pharmacological treatment, right? So we have patients with depression, for example. We have a higher number of the patients that do not respond. 1/3 of patients do not respond to 2 or more antidepressant trials. So we need to present these patients one other possibility, one other treatment approach. And the diet is a modifiable factor. So I can change my diet, you can change your diet, the listener can change their diet. So it is modifiable, and we can really use it in our favor. And it works very differently from a pharmacological approach, because when we take a medication, usually we have a very limited amount of targets. And in the food, in the diet, as in in one food, we have a matrix of several food components working together. They are synergically there in the food. Well, we have them when we eat it. We have these food components can bind and affect several targets. So we can really have benefits in several targets associated with psychiatric symptoms and psychiatric disorders, and modulate and change pathways related to it. So
Yeah, that's such an important point that you raise about the limited efficacy of antidepressants, of the best psychotherapies like CBT. The efficacy rates or remission rates aren't amazing, and certainly not everyone will respond to that. So it really brings to mind the importance of having a suite of different interventions, and something that, like you said, is modifiable, is a lifestyle factor, is something that we all do, we all eat, to kind of add to our armory of tools to treat mental health and mental illness. And so you touched on something really important there in the Mediterranean diet, and this seems to be the most commonly, or the diet with the most amount of evidence in terms of reducing depressive symptoms, right? And there's good quality evidence, like you alluded to, in terms of randomized control trials. For those uninitiated, can you tell us what is the Mediterranean diet? What does that actually look like?
Of course, of course. Well, actually, surprisingly, maybe it's going to be a surprise for some of our listeners, but it's not complicated at all. If I ask you to give me an example of a healthy diet, you probably come up with a very similar diet to the Mediterranean diet, actually. So the Mediterranean diet, it was primarily suggested to be used in the treatment of cardiovascular disorders. It was a study called Seven Countries, developed by Ansel Keys in the 19th. So basically, the diet is composed by a higher amount of fruits and vegetables, and it has olive oil as the primary oil. So all of these food components, they are very rich in vitamins, minerals, and also polyphenols, antioxidants, and anti-inflammatory polyphenols. And there is also a higher amount of whole foods, which is source of fiber. And we know that fiber has an important impact in our gut microbiota, for example. So we have this prebiotic action of this nutrient. And it is actually low in red meat. So the main source of protein is fish and legumes, and low in ultra processed food. So this is maybe one very important characteristic of the Mediterranean diet, because the ultra processed food, we have an increasing number of evidences showing the negative effect, the negative impact of ultra processed food, not only for our metabolism, but also for our mental health. There was one study published in last year, September 2023, that showed, for example, that individuals who eat more than 8 servings of ultra processed food a day have 50% higher chance to develop depression than those who eat 4 or less servings a day. So this data also highlights that the ultra-processed food is not only associated with metabolic disorders like obesity or obesity-related metabolic disorders, but it is also related to our mental health, right? And and the consumption, the consumption of this ultra-processed food, this type of food, is increasing globally. It is already the main source of calories in many high-income countries. So we need to pay attention on that. We need to be aware of the impact, the negative impact of ultra-processed food in our health, in our mental health, and we need to encourage people to decrease the consumption or decrease the amount of ultra-processed food that they eat. And maybe one thing that just popping up in my mind, maybe the listeners are not very familiar with what ultra-processed food is.
Yeah.
I don't know if you know
No,
how to
please tell us.
classify
Yeah.
it, right? How to choose the correct food for us. So ultra processed food is basically, so first of all, they usually comes in packages. And when we read the list of ingredients, we are going to find some ingredients that are not common ingredients present in our kitchen. So they are not culinary ingredients such as sugar, oil, or salt. We are going to find the list of ingredients. We are going to find some ingredients that we have never heard about. So this is a very simple way to classify ultra-processed food. Of course, we have like a better classifications or better way to identify. But for the general public, I think it's an easier way to explain, and we can really choose our food based on this classification. We should avoid this type of food, basically. Yeah. So this is the composition of the diet, more or less.
Yeah, and I think that's a really important point about breaking down what ultra processed food are, because when I was reading for this discussion, I always thought ultra processed food was like just McDonald's and KFC. But looking through, I think it's the Novo classification of
Exactly.
processed foods. I didn't realize that things like 2 minute noodles are ultra processed food. So I went and threw out my packet of 2 minute noodles that I have in the cupboard. So it's interesting to note that foods that we think perhaps are less processed actually fall under the ultra processed kind of banner. So I'll put a link in the show notes for people who want to check out that classification list.
Yes, it's super interesting classification. Was developed by Carlos Monteiro, a Brazilian researcher. So yeah, from my motherland, and yes, and they have his research group has a lot of studies showing the negative effects, the negative impact of this type of food. And the NOVA classification helps us to really classify and trying to track, like, I mean, like when we can classify, we can also can evaluate the impact of it, basically, right? And then, yeah, in the mental health, I mean, like it's a more and more papers are coming out showing the negative impact of it in mental health. So we need to be aware of it as well. Yeah.
Well, okay, so on that note then, right, you brought up this point earlier about it's a very new field, nutritional psychiatry. There's been a lot of observational studies and a few, randomized control trials coming out lately, which is an important thing, I think, for people to note, particularly when getting their information from social media and influencers, that this is a really new field, so you need to be careful with what you digest. With the ultra-processed foods, what's the quality of evidence there? Do we have randomized control trials? Can you even ethically run a randomized control trial and put someone on ultra-processed foods for months? Or is that more observational as well?
Well, we have in the field of nutritional psychiatry, most part of the evidence, as I said, comes from observational studies, because it's very challenging in the field of nutrition perform a clinical trial due to the nature of a nutritional intervention, right? It's super hard to keep people in the same experimental diet for a very long term, and well, of course, the adherence drop a lot over time. So this is a very challenge study design for us. And actually, well, so in the field of ultra processed food, the most part of the evidence it comes also from observational studies. But there was one clinical trial that evaluated the effect of ultra processed food in metabolic and the metabolic consequences of it, and could prove, for example, that it is associated with weight gain and metabolic complications associated with that. But in the field of nutritional psychiatry, we need to have more clinical trials in general, but I think ethically it's a little bit complicated to run a clinical trial involving ultra processed food, because it's going to be hard to convince like the like ethically it's hard to make it, because you cannot provide people with this type of diet to see the effect, because we know that we can cause negative effects. So yeah, in my view, that's the main problem in this topic specifically. Yeah. Besides the whole complexity in developing a clinical trial in nutritional field. Yeah. For this specifically
Yeah.
topic, it's a little bit challenged. Yeah.
Yeah. And again, this is really important, I think, when people are reading through the evidence, to understand the challenges in the quality of evidence and running certain trials. So yeah, that's really good to know. And so if we come back, Lais, to the Mediterranean diet, again, the diet that seems to have the most amount of evidence supporting its use to treat depressive symptoms. The SMILES trial that you alluded to, as I understand it, the symptom decrease that you saw was independent of weight, right? So this is not about losing weight as such. This is more of a direct effect of the Mediterranean diet, independent of any weight changes. Is that right?
Yes, it is right. It is right. It's a very good point, indeed. That in this trial, people did not change the weight, and they had the improvement in the depressive symptoms. However, there is one meta-analysis that have shown that for example, for people that underwent nutritional intervention to lose weight. So, for example, patients with obesity, when they lose weight, when they actually lose, they were successfully to lose weight. They also had a better improvement in the depressive symptoms. We know that there is the bidirectional connection between obesity and psychiatric disorders in general. And probably inflammation is one mechanism that underline this connection, because we know that obesity it is accompanied by chronic low-grade inflammation. So people with obesity have also a higher level of inflammatory biomarkers, and the same for psychiatric patients with psychiatric disorders. So, for example, patients with depression, they also have a higher level of inflammatory biomarkers in the blood. So we have these common mechanisms that underline probably the connection between these two disorders, right? These two diseases, and then, but independently of that, we can have the benefit. So if you are in a nutritional intervention that aims to lose weight or to regulate the metabolic complications that you have, for example, and in parallel, you measure also the depressive symptoms, so you might have benefits on decreasing the weight. That's what I'm trying to say. But in the Ismail's trial, they showed that it's not mandatory for all the patients. So if they are in a good metabolic condition, well, probably the diet itself will help, because we have a lot of dietary components that can be anti-inflammatory or antioxidant independently of the change in weight, you know? So yeah, so it's not like mandatory, but if you are in the nutritional approach to reduce weight or to lose weight, well, we can have benefits on your mental health if you achieve the goal of the treatment.
Mm-hmm. Yeah. And again, such an important point about the physical health of people with mental disorders as well, because people with severe mental illness, schizophrenia, depression, bipolar, tend to have higher rates of cardiovascular disease, obesity, type 2 diabetes, tend to die earlier, 10 to 25 years, that mortality gap, depending on the data set that you look at. So there's direct effects of the diets, like you're talking about, a Mediterranean diet, on the depressive symptoms, but also potentially huge effects on physical health and underlying comorbidities there.
Yeah, exactly. Mm-hmm. Exactly.
Yeah. And so there's the Mediterranean diet, and it seems to have a lot of evidence for the outcome of reductions in depression. What about either the Mediterranean diet or other diets and changes on other mental illness symptoms, whether it's schizophrenia, anxiety disorders? Do we have any evidence there supporting any particular diets and reductions in other mental illness symptoms?
Well, it's a good question as well. Well, as I said, we have a limited amount of clinical trials in the field of nutritional psychiatry. However, there are some other type of diets that are becoming a little bit that are becoming more popular. One example it is the ketogenic diet, for example. That I know that at least there are at least two clinical trials, ongoing clinical trial, one in Finland, another in Australia as well, treating patients with schizophrenia using ketogenic diet. And the ketogenic diet differs a lot from the Mediterranean diet because it mimics the physiological state of fasting by reducing the amount of carbohydrate until approximately 20 grams a day. So, and then we force our body to produce ketogenic body and to use it as a source of energy instead of glucose, especially the brain. And it has been some evidences showing the benefits of this diet in reducing insulin resistance, which, as you said, it's a very common condition in patients with psychiatric disorders. So, well, we have like we can be optimistic about the use of this dietary pattern, and the researchers that study this diet specifically, they usually are very enthusiastic about the results of the diet. Yeah, but of course, I think one important thing to say is that, when we decrease the amount of carbohydrate, we are forced to decrease the amount of fruits and vegetables in our diet, which are important source of vitamins and minerals and fiber. And then it's important to have a nutritional advice. So for all type of restrictive diet, in my opinion, it's super important to have someone to help you to check if you are in risk to develop deficiency or insufficiency, nutritional deficiency or insufficiency, and avoid it. Because if you cut one food group from your diet, you can actually cut an important nutrient. So this is one thing that I think it's important to highlight. But for sure, we will have in the future year, in the close future, good evidences about the effect of these diets, and we will be able to discuss this a bit deeper in in other psychiatric disorders. So we have several clinical trials coming out in the near future. Yeah.
Yeah. Okay. So again, speaks to the nascent and novel kind of nature of the field, and the fact that there's just a lot being done, and I'm sure a lot to come out in the next few years as well in terms of new findings and results. And one of the other diets that I know there's a little bit of exploration on the evidence for its relationship to mental health is the vegetarian diet. And I know when we spoke initially, my first impression was vegetarian diet must be, really positive for the mental health, lots of fruits and veggies, less inflammatory foods. But you corrected me and showed me that perhaps that's not the case. So can you tell us a little bit about the vegetarian diet and mental health?
Yes, of course. You're right. For me as well, I would think that vegetarian diet is a good option because it has been proved that vegetarian diet can be positive, very positive in decreasing overall mortality and cardiometabolic mortality. For example, if you change 3% of the energy from protein for animal protein to plant-based protein in your diet, you can decrease up to 9% the risk of overall mortality and cardiometabolic mortality. Yeah, so it is actually a very nice, I would also suggest that this diet is positive for mental health. However, the recent meta-analyses, they are still conflicting, and we have some meta-analyses that have suggested the negative effect of vegetarian diet in mental health. But we need to be also careful in interpreting these results, because even in the meta-analysis, they highlight that the studies that we have so far in this field is extremely heterogeneous. So we don't have so far like a very quality evidence, very good evidence to say that it's good or it is bad. But as I said, for any restrictive diet, including vegetarian diet, because you're going to cut one food group from your diet, it's better have nutritional advice. It's better have a nutrition professional close to you and and avoiding the deficiencies, as I said. And actually, like the clinical trials that had a nutrition professional delivering the nutrition intervention, they were also more they had a more significant result in decreasing depressive symptoms. So then having a nutrition professional close to the multidisciplinary group, it's also advantage for treating psychiatric disorders. And well, for vegetarian diet, my final answer would be we still need to have better and well-designed studies to be able to confirm and affirm that this is good or this is not good for our mental health.
Yeah, really interesting point about the moderator having a nutritional professional involved in the trial. I'm curious, do dietitians play a role in treatment of mental health, like in actual real world clinical practice? Is that embedded in any healthcare system that you know of?
Well, unfortunately, it's not very common, right? So we need to have I read one study very recently in which they questioning the nutritional professionals about their influence in the clinics, and they highlighted that we need to have a higher awareness about the importance of the nutrition professional in the mental health care team, like the importance of having them, and we also need to have better training for this professional, and then based on that we need to find like a better way to include nutrition in the mental health care. We still need to improve the involvement of dietitian and nutritionists in the field of psychiatry. We really need to do it.
Hello everyone, a quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode.
Yeah, it's a really interesting point. The Royal Australian and New Zealand College of Psychiatrists, so this is like the main body for psychiatrists here in Australia and New Zealand, main national body. I know they recommend that nutrition should at least be incorporated and looked at with the patient for those with mood disorders. But it's very vague, those kind of guidelines. And certainly as a psychologist myself, we were never taught anything about nutrition and its relationship to mental health in our training. I think it's very rare here in Australia you see dietitians embedded in with psychologists in a multidisciplinary team. So potentially a gap there between the evidence and what's happening out there in the quote unquote real world.
Yeah, and this is actually a very good achievement for the field of nutritional psychiatry, like the inclusion of nutritional professionals in the guidelines, in the public guidelines. And in Australia, it is actually a pioneer in several advances on that, especially because we have the influence of Feliciaca and the Food and Mood Center. So we have a lot of studies come from Australia, and we need to use these guidelines as an example for global example, I believe. So I think it's super important to be aware of the importance of it, especially as we said in the beginning of the interview. We need to show more possibilities for to the patients who cannot respond to treatment. So, and the diet as a modifiable factor can really help. So it's going to help also the physicians, because I believe that they will not have another solution. It's better having more tools to treat like patients than like a very restrict number of tools. So in diet and nutrition, it's another possibility. So I think if we all join forces, we can really make it better. We can really help patients to to achieve remission and to improve their symptoms. So yeah, I think it's a very good point you highlighted. We need to bring it to politicians. We need to put in guidelines, and I think it's a very good point.
Yeah, no, it's very important. I mean, it's very much aligned with what I'm trying to do at the podcast, which is, there are discussions on exercise, nutrition with yourself, yoga, different tools for practitioners to be able to utilize in treatment beyond just the typical therapy and medication. And so we're jumping around a lot, but I want to come back to the Mediterranean diet, and this relates to what we've been speaking about just then. So my understanding is that in the SMILES trial, most of those participants were on medication or getting psychotherapy at the time that they were on the Mediterranean diet, which to me speaks to the effectiveness of the Mediterranean diet in conjunction or with first-line treatments like therapy or medication. But from the evidence overall, do you think we have enough to say that the Mediterranean diet as a monotherapy, as a singular therapy, is effective for depression, or should it always be done in conjunction with, say, a first-line treatment?
Yeah, no, I think it's important to say that, it is a complementary and alternative treatment. So I'm not going to say that you can drop your pharmacological medication and adopt a healthy diet and that's going to help you. No, we need to make it in conjunction, as you said. The nutritional intervention, or even the supplements, like as a monotherapy, we do not have a very good result. Actually, especially for the supplements, the diet. I believe that the nutritional research is shifting from using one supplement or one specific nutrient to use the dietary pattern as a role. Because from the supplements, for example, as a monotherapy, we do not have a very good result. There was one clinical trial that trying to provide people with a very comprehensive nutraceutical and nutritional supplements. So they really provide a very good combo, a very good number of potential nutrients that could affect mental health. For 8 weeks, they treated patients, and actually they had the placebo group that had a superior result. So as a monotherapy, especially supplements, we do not have a very good evidence. However, the dietary pattern we really have a very good evidences in combining the dietary pattern and the first line treatments. So I don't think it's I don't want to pass the message that you can drop your treatment. No, we need to combine it. Even supplements. I mean, for the supplement that we most have. That we have the greatest number of evidences, the omega-3, for example, we usually do that in combination with the first-line treatment. So yeah, the omega-3, just to talk a little bit more about it, because I just mentioned very, very fast. So omega-3, it is a polyunsaturated fat acid that we can find in fish. And also in some plant-based fleshes. So then the omega-3, it's a very interesting anti-inflammatory and antioxidant food component, and it can, as a fat acid, it can deposit in our cell, the membrane of our cells, and it can improve the fluidity of the membrane. It can decrease neuroinflammation, can improve the communication between cells. So omega-3 has several potential benefits in the pathways of metabolic and psychiatric disorders. And then it is the one that we have a greater number of evidence. There is even a guideline from the International Society for Nutritional Psychiatry Research with some advices on how to use omega-3 as a complementary treatment for depression. So it's also a good reference that we have in using that. Yeah.
Okay. Yeah. Fantastic. Let's double click then on omega-3. So what are the outcomes that it can help with in terms of mental health? Is this depression? Is this cognition? What are we talking here?
Both of them, depression and cognition, because, there is one interesting factor about how the nutritional components can help. What's the mechanisms underlying the association between nutrition and mental health? And they are actually very interconnected, because, for example, omega-3 has a very, very important anti-inflammatory effect. And if you target inflammation, you're going to improve the insulin resistance, because some inflammatory biomarkers, they can interfere in the insulin signaling, intracellular signaling. They can block the intracellular signaling of this hormone. And also, if you target inflammation, you can also improve the production of neurotransmitter, serotonin, dopamine, because, again, some inflammatory biomarkers, they can also interfere in the pathway, the production of these neurotransmitters, and can also decrease the production of them. And then, so I'm saying that just to circle back to the beginning of the question. I'm saying that because omega-3 has several mechanisms, and it's not only one target. And if you target one mechanism, you can also change other. That there are a lot of associations with psychiatric disorders. One other interesting thing about omega-3 and also polyphenols, they were recognized also as prebiotics. So they can also change or modulate our gut microbiota. So, the prebiotics are nutrients that increase the population of beneficial microorganisms in our body. And basically, we had this connection between gut and brain, this very well known connection. So the brain and gut, they talk with each other all the time. We have signals come from the brain to the gut via vagus nerve, and our microbiota can really interfere our immune response, and then ultimately affecting our brain functioning. So we have this communication as well, and and food components that can affect our microbiota for good. For example, the omega-3, the polyphenols, fiber, which is a very well-known prebiotic, fermented food. So all these type of foods can really modulate our gut microbiota and decrease the amount of pathogenic microorganisms and increase the amount of symbiotic microorganisms, making our gut microbiota a little bit healthier. And then we can have the benefits of it for our brain functioning, for our mental health. Yeah. So I hope I answer your question. I'm not sure. But maybe I changed a little bit the subject because it's everything connected.
Yeah, exactly right. I mean, look, the gut microbiome, gut microbiota, gut brain axis, these are terms that are thrown around a lot. Yeah, and they're thrown around a lot these days. And to be honest, as someone who is far from an expert in this field, it's hard to know what to believe, what to trust. particularly as this is such a new and novel pathway as well. So the whole prebiotic affecting prebiotic foods, probiotics, things like kimchi, sauerkraut, kombucha, they can make a genuine difference on the health of our gut microbiome. Is that correct?
Yeah, well, modulating the microbiota, yes, I would say that, nowadays it's very well established that the microbiota has influence in our brain, and we should really pay attention on the effect of what we eat or our nutrition on it. So this, yes, like the bidirectional connection between brain and gut, I can say that it's well established, and we are trying now to evaluate which type of intervention we can make to have the benefits of modulating our gut microbiota. And as you ask about the probiotic intervention, so there are some good amount of clinical trials that have tested the use of probiotics in treating depression, for example. And apparently the effect of this intervention is more significant in patients with a more severe symptom. So when you test the effect of probiotic in non-clinical patients, for example, people without any type of psychiatric symptoms or psychiatric diagnosis, so the effect seems to be smaller. And when you test in people with a severe symptom, usually the effect is better. In nutrition, usually we have it. And that's the reason we need to combine the nutritional intervention as well. It's another reason that we need to combine the nutritional intervention with the pharmacological intervention and other type of interventions. Because usually those who have a more severe symptom, they have a better response. They respond better to the nutritional intervention, including probiotics. And the probiotics with a higher number of strains, which means when you take a probiotic, we see the name of the bacterium there. So those with the higher number of the strains, they also showed better results instead of one single type of bacterium, for example. But the field of microbiota, it's growing very fast since last years. And one thing that I think it's super exciting to see the effect of modulating gut microbiota, but there are also other studies in the microbiota of other parts of our gastrointestinal tract. So, for example, the oral microbiota also seems to have an impact in our mental health, and there are some studies that have shown it. So, so I'm saying that just to highlight that it's not only the gut microbiota, but the whole gastrointestinal tract that might be important in modulating our mental health, in improving our mental health.
Okay, and so what's the relationship between the gut microbiota and the GI tract? Is the gut microbiota part of the GI tract, or are they separate completely?
No, it is part of, when I say all the organs, part of the gastrointestinal tract, from the mouth until the end of the gastrointestinal tract. Yeah.
Yeah, right. Okay. Wow. Okay. Well, so we've talked about different mechanisms, inflammation, the gut microbiota. One is that I like to explore is the concept of neurogenesis, BDNF. Can you speak to potentially how diet impacts neurogenesis or neuroinflammation, like you alluded to earlier?
Yeah, well, some nutritional components can modulate the production of BDNF. So then we know that it is a molecule associated with neurogenesis, and then we can really modulate it, neuroplasticity and neurogenesis. So not only the food components, but also the microbiota itself. So some probiotics, the use of some specific probiotics also had effect on increasing the production of this marker, and consequently, we can have a modulation in neuroplasticity and and the benefits of it. And neuroinflammation, I would say that, as I said, for when I was talking about omega-3, decreasing inflammation, so the food components can act in cellular level, in gene expression, changing and decreasing the production of key molecules associated with inflammatory exacerbation in inflammation. So if we have it, if we have anti-inflammatory food components in our diet, we can also regulate inflammation systemically, and we cannot split our body between our brain and the rest of the body. So everything that's happened metabolically, everything that's happening in our body, we also have consequences in our brain. So decreasing inflammation and modulating gut microbiota can also influence our brain functioning ultimately. So it's not like that we can split the system, right? We are one entire machine. So yeah. So I would say another thing that can also food components and nutrients can interfere. It is the oxidative stress, and we know, for example, that patients with psychiatric disorders, they have a higher level of oxidative stress marker, higher level of inflammatory markers, and some nutrients, they can act in enzymatic antioxidant defense because they are cofactors. For example, selenium, copper, zinc. They are cofactors of specific enzymes associated with our antioxidant defense. And some other nutrients, such as vitamin C, vitamin E, they can neutralize free radicals. So we can really work decreasing the oxidative stress by using our nutrients or what we have in our food.
Yeah, definitely. And I think with the BDNF side of things, I mean, again, people with major depressive disorder have higher rates, or more likely rather, to have lower BDNF in the hippocampus, a smaller hippocampus. So again, this speaks to potentially one of the mechanisms underlying things like the Mediterranean diet, right, which are lower in those pro-inflammatory foods, and its effects on depression. So there's just multiple potential hypothesized mechanisms and many routes with which lower inflammatory diets can work their way into reducing depressive symptoms.
Yes. And just a parenthesis about because you mentioned about the size of hippocampus in patients with psychiatric disorders. There is one interesting study published by Feliciaca again in 2015. It was an observational study, and she showed that Western diet is associated with a smaller volume, hippocampal volume. So, and a healthier diet, a healthy diet can be associated with a least reduction in the hippocampal volume over time, because we tend to have a reduction in the hippocampus over time, and then by adopting a healthy diet, you can prevent this reduction. And as you said, as you mentioned, the hippocampus, because, it is a very important brain area associated with learning, memory, and mood regulation. And so we have the influence of the diet on this brain area as well. So just to highlight, because we were talking about neuroplasticity, and one important area to look at when we are evaluating the effect of diet and brain structure, it's really the hippocampus.
Yeah, it's really exciting to hear about all these hypothesized mechanisms. And I suppose, I mean, it sounds like there's no real black and white answers, and that's reflective of depression and most mental illnesses themselves in terms of the etiology or causality. We don't really know. We have just all these hypotheses. But it seems like there's a lot of not just biological plausibility with some of these diets, but now good randomized control evidence to support some of the mechanisms that you're purporting, which is really exciting. And I do wonder if we have this conversation in 5-10 years time, round two, what new findings will have come out by then.
Yeah. You're right. I think in the next 5-10 years, we're gonna have much more information. Yeah.
Well, we could talk, and I'm sure you'd be able to educate us a lot more on the mechanisms of why some of these diets work in terms of reducing depressive symptoms. But let's move towards a big topic of your more recent research, which is sustainable food systems. So talk to us a little bit, Lais, about the environmental impacts that food and our eating patterns and habits have on the planet.
Yeah, well, thank you for giving me the opportunity to speak about it because, it's a new field and it's very alarming. The climate change, it's something that the World Health Organization has recognized climate change as the most significant health threat facing humanity. So we need to look at it and trying to fight against climate change. And actually, our food system, it is a very important factor playing against us on this topic because the way we produce, the way we transport, the way we eat, our food system, it is responsible for for example, up to 30% of greenhouse gas emission, 70% of freshwater use, 40% of land use. So we do have a big impact of our food system in the environment. So based on that, some recent researcher have trying to suggest some solutions for this situation, right? And there is one interesting dietary pattern that was published in 2019 called Eat Lancet Diet, in which a group of 37 scientists, they gathered trying to find a solution for the increasing population. And they came out with a dietary pattern, which with a recommendation, with a suggested dietary pattern to us, to suggested to be healthy and also environmentally sustainable. But we still do not know the actual consequences of it for our health. So more and more, since 2019, more and more studies are coming out showing the potential effect of this dietary pattern in decreasing mortality and cardiometabolic disorders. However, we still do not know the effect of it in mental health. Because this diet, as we had previously, the talk about the vegetarian diet, this diet, it is not a vegetarian diet. It is a flexitarian diet because it allows us to eat a slightly, like a small amount of meat a day. For example, for chicken, it is around maximum 58 grams a day, for example. And so it's not vegetarian, it is flexitarian. However, we know that the production of meat, it is an important factor in this destructive role of our food system in the environment. So it's important to say that, if we need to have a more environmentally sustainable diet, we might have cut the amount of meat in our diet. This is true. But we still do not know the effect of it. So now in the Geneva School of Health Science here in Switzerland, I am working to trying to evaluate the association between this specific dietary pattern, the Eat Lancet diet, in mental health. So we have a cohort study involving more than 5,000 patients, followed by more than 5 years. And we are trying to see if this specific dietary pattern can influence their mental health. And well, maybe in 5 years, as I said, in 5 years, they're going to have much more information, and I'm going to bring the results of this and hopefully other studies in the field, because I think we cannot just turn a blind eye to the impact of our food system in the environment. We need, as a nutritional scientist, we need to be aware that this is something that we are facing, and this is something that we need to fight against, because, well, it is, as I said, the most significant health threat facing humanity. So we need to try to bring like more solutions and trying to decrease the impact of our food system in our environment.
So, okay, can you tell us a little bit about like how some of the common foods that we eat? So I'll give you an example. I eat a lot of chicken, tuna, rice, oats, porridge, McDonald's a couple times a week. How does some of those foods impact the environment? You know, what's the mechanism there in terms of those foods and our consumption of those foods having a negative impact on the environment?
Well, basically, if we consume more, we produce more. And as I said, the production of food, it has a big impact in the production of greenhouse gas emission, use of the land. I mean, like we are, by producing a large amount of meat and using a large amount of pesticides, we are polluting our land, we are polluting our water, and we are causing loss in our biodiversity because of that, because we are using these pesticides. And so basically, that's the way what we eat impact the environment, because by eating that, we will force the system to produce more of this type of food, basically.
Okay.
So
right.
One ideal world, we would eat only seasonal food or organic food or food that do not have this impact, or even like food produced by farm agriculture, like local farm. I mean, like local food. So it's important to use like the way we eat to fight against the climate change in this way, like, because it's a very important factor associated with climate change and production of greenhouse gas emission and so on, as I said.
Yeah. So, and you mentioned that the Eat Lancet diet is like, I think you said 58 grams of chicken in a day. Oh my God, I eat like 58 grams of chicken in one meal. So I have to make some changes there. So what's the issue particularly with meat? Because it sounds like it's not demonizing meat, but moderate to large consumption of meat in particular is bad for the environment.
Yeah, it's actually based on the use of land, the use of fresh water to be able to produce this specific food group. So it is actually, if we decrease the amount of meat in our diet, we can have the most significant impact in decreasing the production of greenhouse gas emission, the use of land, fresh water, and so on. So it is actually the food group that more alarming, that we need to pay attention. But I understand that meat, for example, for the ketogenic diet, it is one very important food group. So in the end of the day, we need to understand that there will be a more effective types of dietary intervention for a specific group of people. So maybe we are going to be able to use ketogenic diet for treating schizophrenia, for example, if the researchers prove that it's important. You know what I mean? And then for this type of diet, we need to have a higher amount of meat. However, if we can, as a society, work on changing our diets to make it more sustainable, it's not only the meat, but it's also like to choose more local food, seasonal food. These will be very beneficial for our environment. So treating mental health and environmental health, it's very tricky because we need really, it's hard to isolate both, because I think like the impact of food system in the environmental, it's something that the nutritional field as a whole needs to be aware. However, there will be more specific diets that has a higher benefits for specific groups. So yeah, and the meat, the amount of meat, well, it is a topic in the sustainable diet that we need, that it's most, I mean, like that we have the highest impact.
Yeah, it's really interesting. If I just reflect personally, so from what you're saying and from what the research says, this Eat Lancet diet is the most planetary, healthy diet that one can have. It's particularly beneficial for the planet, but also for us individually. But then I think about my own values and why I eat what I eat, which is not the Eat Lancet diet. And these are things like to support my performance in exercise. There's a cultural element in terms of food being, shared experience with my family. So I suppose what I'm getting at is, from a behavior change point of view, if maybe I should have environmental sustainability is at the top of my values, but if I'm honest, it's not. How do you go about getting people to actually adopt and adhere to this when there are all these other competing values people have when they eat food?
Yeah, well, actually, this is super important for the nutritional field, because like when we recommend a diet for someone, we need to respect their background. We need to respect their culture. We need to respect their stage of life, because sometimes we are in a moment in our life that we are not going to be able to change our diet, right? And I think this, it's important to say that for the listeners and the consumers of, I mean, like in general, that, well, for some people, it might be hard to change their diet, even if you have the knowledge that it is important for your environment, it is important for your health, and we need to respect it. However, the more we know about the benefits of the diet, the more we are going to be willing to adopt a better, a health diet, right? So I think one thing that we need to know is that, well, trying to increase trying to increase your knowledge on the benefits of it, trying to read a little bit more, like trying to, if you're trying to get like a little bit into the information, into the science, the evidences, I think we can convince better the population and people about the importance of it. But we need to have politics also behind it, because we need to have like powerful from them, like the power from them to help us to come with information and guidelines, as you said, that you have in Australia. And well, we need to make it as a society, because it's something that it's facing the society, right? Like the increasing number of mental health problems, the climate change, they are two important health problems that we are facing in the society, and we cannot pretend that it's not happening. So I think like the way to convince people to change, well, it's not only in our hands. So we need to make it as a society. But when we face someone, like when we're trying to advise someone, we need to respect their culture. We need to respect their stage of life. As I said, we need to try to understand and then act in that factors that it's missing. So for you, for example, if you tell me now, Lais, I can't cut the amount of meat that I eat, and I can't change for a Mediterranean diet, I can't go to a ketogenic diet, even if I say as a dietitian that it's going to help you in your symptoms, well, I need to respect it. I need to trying to go in another way, you know, like, and tell you, okay, if you cannot do that, if you cannot eat, decrease the amount of eat in terms of the impact in the environment, You can prefer, for example, seasonal food. You can prefer local food, local produced food. You can prefer having a higher amount of vegetables and trying to shift a little bit the amount of protein source in your diet. So we have several possibilities, but I mean, like it needs to be individual, like based on the individual needs and based on their what type of necessities they have, what type of metabolic or psychiatric or any type of disorders they have. So we need to make it very specifically for each one of us. I think we cannot, but as a group, as a society, we need to bring awareness, and we need to be aware of the impact of what we eat in our metabolic health, in our mental health, in our environment. So I think this is a very important mission to make it more clear and accessible.
Yeah, no, it sounds like some very important work that you're doing, tackling, huge societal issues, both mental health and environmental sustainability. So certainly take my hat off to you for the work you're doing. And I'm excited to see the results of the Eat Lancet diet on mental health. That'll be a really cool space to watch. Well, is there anything finally, Lais, that you wanted to share with listeners?
Well, I think we cover most of the topics, I believe. I think they might be curious about they might be wondering about the composition of the diet, and we talk a little bit about it. And I think it's important to this final topic about the awareness. And I think we cover most of the most important topics. And I just want to say that for those who would like to connect with me, I am open and I would love to share like more information. If there is any other update or information from the researchers who want to contact me, I'm very open to talk and learn from other experts about the field and about the psychiatry field and nutrition. I'm completely passionate about it. And thank you, Indy, for the opportunity to talk here. I hope I could help the listeners to increase their awareness about these pressing problems that we are facing in the society currently.
Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental wellbeing. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.